Hi there, this is Dr. D, what facts and news that you can use. My name is Dr. Dotson. I am a cataract surgeon, I'm a cornea transplant specialist, and a laser refractive surgeon. I am very passionate about patient care, but I'm even more passionate when it comes to patient education. I want to help provide various eye facts and eye knowledge so that you too could learn a little bit more about eye health and eye wellness. Today, we're going to be talking about cataracts. What are they? What is cataract surgery? What are the different options for me? Let's get started. The objectives for today are to better understand the basics of what a cataract is. We're going to talk a lot about cataract surgery, and we're going to help demystify and help answer additional questions that you might have. And we're also going to go into a dive on understanding the different options as far as the lenses that can be placed into the eye at the time of cataract surgery. So first question is, what exactly is a cataract? Every patient that comes into my clinic for a cataract evaluation, I always ask them this question. Most patients do not know what a cataract is, but that's okay. I explain it to them. I do have some patients that come in, they know exactly what a cataract is. So what is it? It is the clouding of the natural lens that is inside of the eyeball. So did you know there is a natural lens that is inside of the eye? In order to understand what a cataract is, you got to go over a little bit of eye anatomy. The very front part of the eye, the windshield of the eyeball, is called the cornea. That's the clear windshield. That's what my specialty is. Behind the cornea is the colored part of the eye that is called the iris. And behind the iris, you have this natural lens. When you are younger, when you are born, this lens is nice and clear. And the job of the lens is to focus light inside of the eyeball so that it properly can hit the retina so that you're able to see. Now, as you become more seasoned in life, as I like to tell my patients, that clear lens becomes more and more cloudy. That is all that a cataract is, the cloudiness of the lens that is inside of the eye. So, what are the different risk factors as far as developing a cataract? The most common reason is aging. Now, if you live to be old enough, you will start to develop cataracts. Everyone on the planet, if you live to be old enough, will start to develop cataracts. There isn't necessarily an exact age as far as when they start to develop, but I like to tell patients around age 60 and above, you will begin to have mild changes of cataract. What does that mean? Where the cataract might be just a little bit cloudy, but it might not affect the vision just yet. But over time, as you continue to age, the cataract will become more and more cloudy, and the vision can become progressively more blurred. We do not have to worry about doing cataract surgery until it becomes visually significant, and that's something that we'll go over here in a moment or two. Other common reasons to develop cataracts, actually even at a younger age, could be uncontrolled diabetes. That's a risk factor. If there's a history of trauma to the eye, if there's a history of previous surgery to the eye, if there's a history of patients utilizing chronic oral or inhaled steroids like prednisone, that can definitely lead to an earlier onset of cataracts. UV light exposure can cause cataracts as well. There are different types of cataracts. We're not going to go into the details of that, but UV lights can cause one of them that's called cortical cataract. And there are even congenital factors, such as infections in the womb or even genetic congenital factors that can give cataracts even to babies. But we're not going to go to the details of that. Most important thing is that aging is the most common reason that patients develop cataracts. So what are the symptoms of cataracts? The main symptom is having a progressive blurriness of vision over time. Usually patients will come in and they will say, doc, I'm having trouble with seeing. One of my favorite things that I hear, especially from my VA patients, is that I can't see the ticker at the bottom of the TV when they're trying to watch sports or when they're trying to watch the news. And quite commonly what happens is patients, they come in, they notice this blurriness of vision. We try to get them a new pair of glasses. However, the glasses cannot improve their vision that used to be correctable to 20/20, etc. And then we dilate their eyes, we take a look at the lens, we notice that the cataract is there. That is when we usually help determine if the cataract is visually significant or not, okay? Another important symptom that patients will commonly come in and talk about are that they complain about glare and halos when it comes to driving at nighttime and especially with bright lights. Patients will be like, "Hey doc, like I gave up driving at nighttime because I can't see. Those darn LED lights, they blind me every time. I think that the cataracts are getting worse. What are my options?" So these are the common symptoms that patients can talk and complain about. So what can be done? So like I talked about, glasses can be prescribed initially. When patients begin to develop cataracts, their eyesight becomes a little bit more nearsighted. And that means that they might need just some extra glasses to help boost up their vision so that they can see well at distance. But as the cataract becomes more and more visually significant, glasses then will not be able to help. And it's usually at that point when we decide on, I'm like, hey, may want to consider cataract surgery if we want to improve the vision. And that's the second point here. What can be done if you have a cataract is cataract surgery. You can't believe everything that you read and see on the internet. And I'm here to tell you that there is no eye drop. There is no pill. There is no special superfood. There is no wonder drug that will either prevent you from getting a cataract overall. And there's nothing that you can do that will get rid of a cataract at this point in time. Cataract surgery is the only option that is available if you want to get rid of a visually significant cataract. So what is cataract surgery? There's a lot of questions that I get from my patients, and I love it. I love it when patients come in with questions. I love it when they have some concerns and they're interested about their care, and I'm there to help answer all the questions that they do have. So cataract surgery, it is the most commonly done surgery in the United States. It is an outpatient and an elective procedure. It's outpatient, meaning that you come in, you have surgery, and then you get to go home the same day. And it's elective, meaning that it's not an emergent or urgent type of surgery. We get to schedule you depending on the surgery scheduling, or if it's academics versus private practice, you could get scheduled out on the course of several weeks. Sometimes it might be a few months, but it's an elective procedure. It's a very fast procedure as well. On average, takes between 10 to 30 minutes. It depends on the nature of the cataract, but it also depends on the cataract surgeon as well. But it's a very, very fast procedure for patients. And what it entails is removing that cloudy lens that is inside of the eye, and then we place in an artificial lens that'll last you for the rest of your life. And this is just a photo just highlighting what that artificial lens looks like. The lenses, they're made of different materials. Most of them at this point in time are made out of acrylic. There are some lenses that are made out of silicone as well. There are additional types of lens choices, and we've used lots of materials even from back in the day. So most commonly, we work on one eye at a time, where we do one eye on one day. Usually it's the eye that's seeing worse. And then a few weeks afterwards, we will work on the second eye. There are some surgery centers, there are some doctors who like to just do both eyes at the same time, and that's totally okay. There are some patients who have certain circumstances that prevent them from coming back for multiple visits to see the surgeon, and they may be a good candidate for having both eyes done at the same day as well. Totally up to you. Ask your surgeon about it if that's something that you're interested in. And the big question I get all the time is, well, doc, what about my anesthesia? What about sedation? Am I going to be completely out? And I can tell you, 99% of patients, when they have cataract surgery done, they are not. It's not under general anesthesia. It's done usually under light sedation. So what does that mean? That usually means that you have a nurse anesthetist or an anesthesiologist. They put an IV in your arm to help give you some relaxing medication so that you are nice and relaxed. You're a lot more comfortable. You're less anxious. You still technically are awake, yes. However, patients, they tolerate this incredibly, incredibly well. Just the risk of doing general anesthesia is so much higher, as well as because our surgery is very fast, that general anesthesia usually is not needed. However, there are some patient circumstances where general anesthesia is required. We also use very strong numbing eye drops at the time of surgery, and then we also place in some numbing medication inside of the eye. So a big question that we get from patients is surgery going to be painful? And the answer is no. Because of the numbing eye drops, you should not feel any pain at the time of surgery. You might feel a little bit of pressure as the lens is going into the eye, as well as some of the fluidics into the eye, but you should not be in excruciating pain during your cataract surgery. So these are some of the most common questions that I get from patients when they come in for a cataract evaluation, and I'd like to talk about them. So how am I positioned for surgery? It's a very good question. For cataract surgery, the positioning is you are lying completely flat in the operating room table. There are some patients who they might have some issues as far as like neck and back problems. However, we try to get you positioned as best as we can so that you are comfortable and so that you're able to do well during surgery, which I mentioned takes just about 10 minutes to about 30 minutes maximum or so. Another question is, how will I keep my eyeball open at the time of surgery? So that's a very good question. We use these eyelid holders. We call them eyelid speculum, and they are used in order to help keep the eyelids nice and open at the time of surgery. You don't have to worry about like, well, what am I going to do if I blink accidentally? It's totally okay. This is what we use here. Another question is, I'm nervous about instruments and things coming near my eye. Will I see the instruments at the time of surgery? And the answer is no. Because you're looking at the microscope light, which is very bright, that usually blocks out your central and peripheral vision. In addition to your good anesthesia from our anesthesia team, you should not see the instruments coming towards the eye. And that's pretty much what we tell patients as far as what to expect. And then patients also want to know, well, like, what's going to happen during surgery? What are the details of surgery? What is it that I'm going to experience? I've never had this done before. What's going to happen, doc? And that's a very good question. So modern cataract surgery is done with using a device that is called phaco emulsification. Basically, it is almost like a pen or a pencil that is used, and we use the edge of this pen or pencil type of device here, the phaco emulsifier here, and we go into the eye and we break up your cataract into little pieces and we suck them out. We get them up and out of the eye, and then we place in that new artificial lens into the eye that I mentioned will last you for the rest of your life. The phaco emulsification probe, it is very small, so your incisions for cataract surgery are also very, very small. Quite commonly, most times, you do not need a suture or you do not need a stitch in the eye. When you're having cataract surgery, we make our incisions so that they are self-sealing most of the time. There are some times, and there are some surgeons who will place a single or a few stitches into the eye, and that's totally okay. Those stitches will eventually come out, but for routine cases, for the most part, we don't need to place a stitch into the eye. Okay. And to go over some of the additional questions here, as far as like what else will you experience at the time of cataract surgery, there are some sounds of which you can expect to hear when you're having cataract surgery. It might sound kind of like some musical notes or musical tones. That is just the phaco emulsification probe doing its work during surgery. And then I've already answered the question as far as, is surgery going to be painful? Is it going to be uncomfortable? And the answer is, once again, nope. We use really strong numbing eye drops. We also place some numbing medication directly into the eye just so that you are as comfortable as possible. Now, with any procedure, there's always going to be risks that need to be discussed. So doesn't matter if it's a minor procedure or if it's a major procedure, there are risks that need to be talked about. With having cataract surgery, there's always a very small risk of the vision being decreased long-term after surgery. Okay. There are some cases that are going to be more complicated than others. The more complicated the cataract surgery is, the higher the chance of a risk of something happening. However, we don't anticipate these things to happen to patients, but it's just something that you have to consider as we go through the consent with you in clinic. There's always a risk of infection after any type of surgical procedure, but we will place antibiotic directly into the eye, or there are other surgeons who do both antibiotics in the eye as well as antibiotic eye drops afterwards. There's always a risk of prolonged inflammation, but we do give you steroid, either eye drops or steroid injections at the time of surgery. There is a risk of retinal tear or retinal detachment after having cataract surgery done. But that's something that we tell patients, hey, if you start to notice a significant number of flashing lights, a significant number of floaters, etc., that's something that you need to call and let us know about so that we can get you seen as soon as possible. There is always a risk of the cataract falling onto the retina in the back of the eye. This is a very rare risk, but it is something that we need to consider. If this does happen to you at the time of surgery, then you will need to have an additional surgical procedure by a retina specialist to take out the remaining pieces of the cataract from the back of the eye. And just like with any procedure, there's always a risk of needing additional surgery afterwards. But like I talked about, these risks, they're very low, but we have to mention them to you before you sign on the dotted line for the consent. And then post-operative management. What's going to happen in the post-operative period? So I tell patients all the time, expect for your vision to be blurry immediately after you've had surgery. You got to remember, you just had surgery. You're not going to be seeing perfectly the very first day, and sometimes even the very first few days after surgery. However, you can expect for the vision to gradually improve each and every day for you. In the post-operative period, depending on your surgeon, eye drops, they can be utilized. Plus or minus. There are some surgeons who do what we call dropless cataract surgery, where we use all the medication at the time of surgery and you do not need eye drops afterwards. There are others who will otherwise use like a steroid eye drop, plus or minus an antibiotic eye drop, plus or minus like an NSAID. The steroid eye drops are given as a taper. So most commonly for routine cases, we do like 4 times a day for a week, 3 times a day for a week, 2, 1, and stop, etc. Expect to wear an eye shield at bedtime for at least 1 week. This is just so that you don't accidentally rub your eye or hit your eye while you're sleeping, and just because we don't want to mess up the very hard work that we did on your eye. We tell patients, we don't want you bending over past the waist. We don't want you doing heavy lifting or extraneous work for at least 1 week. You can ride a stationary bike. You can do some light walking, but I don't want you running a marathon immediately after having your cataract surgery done. I tell patients no swimming, do not submerge your head underwater at least for the first few weeks after having cataract surgery. And the purpose of this is because I just don't want the chance of having a bad infection, which can happen, but this will reduce the chances of that happening for you. And then glasses. So usually 1 month after cataract surgery, that's what we tell patients to expect the amount of time for everything to kind of heal and settle into place. That is at the point in time when we will get you fitted for a new pair of glasses if they are needed. And that's why we have plus minus there. Okay. So options for lenses. I think that this is a very, very important topic and a very important slide because this is something that many patients may not know about. And I think it's good in order to think about this ahead of time. I want for you to think about your target. If you're going in for a cataract surgery evaluation, think about your target ahead of time. What does that mean? So there are some patients who are plano vision, where basically they don't need eyeglass prescription to see well at a distance, and they want to keep it that way. So if you have cataract surgery, you may want to keep it that way where you have a lens that is targeted for distance as well. Now, there are also patients who are incredibly nearsighted, and they love being nearsighted. They love taking off their glasses to see things up close. They love reading books without needing glasses. They may want to keep it that way. Let your surgeon know so that they can put in a lens that targets you for being able to see up close as well. Now, there are different types of lenses. There is what we call a monofocal or a single focus lens. This is a lens that is targeted for only a single focus. So you can either see at distance or at mid-range or up close. You can't get a combination of the three of them. Technically, there's a way that there's a little fudge factor around that, but you can't get a combination of those three all together. The monofocal lens is covered by Medicare and insurance in general. It's not a premium lens. Now, there are ways you can get around that, though. With a monofocal lens, you can do something that we call a mini mono, where you target one eye for distance and the less dominant eye for a little bit mid-range, a little bit up close. And we do that so that the lens targets are not too far apart where you're uncomfortable, but this gives you a bit more of blended vision without having to pay the additional cost of a premium lens. Now, you do have premium lens options as well, including a toric, a multifocal, light adjustable lens, et cetera, et cetera. A toric lens is a lens that's used to help balance out visually significant astigmatism. Ask your surgeon, do I have astigmatism? Do I qualify for a toric lens, et cetera? And basically what it is, it's this lens that's on the bottom over here. It has these three individual lines. You put it into the eye and then you spin it to the certain degreed axis to help balance out the astigmatism that is in the eye. These premium lenses do cost extra, and each surgeon they'll have a different cost. So you can expect to pay on the course of maybe even a few $1,000s per eye. However, this will help to reduce the need of glasses. And if it's a single focus toric, then kind of similarly, you balance out the astigmatism and then you set the target either for distance, mid-range, or up close. There are also multifocal toric lenses as well, where you balance out the astigmatism and you also get the range of distance, up close, as well as mid-range. Now, multifocal lenses, they have multiple focuses. The example is this photo that's up top here, where you have these multiple rings. Multifocal lenses, they will reduce the chances of you needing glasses as far as that distance, mid-range, as well as up close. However, there are trade-offs. One of the trade-offs is your contrast ability or your contrast vision might not be of the best quality compared to a monofocal lens. You also might be a lot more sensitive to halos or glare around lights with a multifocal lens, but do talk about this with your surgeon as far as if you are a candidate, yes or no. We also have extended depth of focus lenses, which you can also talk about with your surgeon too, which is kind of like an in-between of a monofocal, but it gives you a little bit more of blended vision. And we already talked about the mini monovision and regular monovision. So regular monovision is, I do have some patients that come in and they tell me like, hey doc, I've been using a contact lens in my other eye to help see things up close. And that's what we call like regular monovision, where one eye is for distance and one eye is for up close. And if they want to keep it that way, you can do that at the time of cataract surgery. I do have some patients that come in that say that they want regular monovision, and I try to get them tested out for it by using a contact lens, and sometimes they like it, sometimes they don't like it, but that's okay. So important questions to ask your surgeon. I think that these are very important things to inquire about with your surgeon before having cataract surgery. Do I have any factors that would disqualify me from having a premium lens? This is a very important question. Now, cataract surgeons, we are very good at what it is that we do. We love what it is that we do. There are some places out there that will try to upsell you on a premium lens. You do not have to have a premium lens if you do not want it. However, this is a very important question. If you have any issues with regards to your macula, or if you have significant changes related to glaucoma or even other changes inside of the eye, you may not be a good qualifier for a premium lens, because there are patients where if you put in a premium lens, they may not like them, and you may have to go back under the knife to have the lens changed on out. So this is a very important question in order to inquire about with your surgeon. Is there anything on my exam that disqualifies me from having a premium lens? And then the other question is, do I have enough astigmatism in order to qualify for a toric lens? And if you do, then great. If you want that premium lens, you can get it. If you don't want the premium lens, you can also ask your surgeon, is there any other procedure that can be done in order to help balance out my astigmatism? Even if it's not a whole lot of astigmatism, you could do like a limbal relaxing incision in LRI. There are other different things that the surgeon could consider for you in order to help balance out astigmatism and to do what is best for you. And then kind of the additional question that I get from patients is, well, what about months and years after I have cataract surgery? Are things going to change? Is anything going to happen that's different? And like what I mentioned, the lens that's put into your eye, it lasts you for the rest of your life, that artificial lens that's placed into the eye. So when we do cataract surgery, that new lens does sit inside of a capsule. A capsular bag is what we call it. Now, you can get cloudiness or opacification of that capsular bag for the lens, and that's something that we call PCO. And a lot of symptoms, they're similar as if the cataract that you initially had is trying to come back, where you're like, doc, you took out the cataract, but it seems like I'm getting a cataract again. What's happening? What did you do? And it's just the cloudiness of that capsule, which you can see in these images before as well as after. And if you want to have that fixed, it's a procedure that's done in office. It's not painful at all. It takes about a minute or two. It's called a YAG capsulotomy, where you take a very fine pinpoint laser, you focus it on the back capsule of the capsular bag, and then you fire a few little laser shots here in order to help create a nice little opening. And this will help clear up the visual axis so that you're able to have that good quality vision once again. This is a very low risk procedure. Every patient will have a few floaters immediately afterwards because you are creating that opening and you are creating some debris, but that usually settles down after a few days or so. But this is the most common thing that we see after cataract surgery for patients that might need just an additional procedure following cataract surgery. So I want to say thank you so much for sticking around and listening to my talk. I really do hope that this was helpful, that it helped to answer additional questions or concerns, or if there's any anxiety about what a cataract is, what is cataract surgery, what's going to happen. If you have any additional questions or concerns, feel free to reach out. If there are any other important ophthalmology topics that you would like to learn about, please do reach out to me as well. Like I said, I'm very passionate about patient care as well as patient education. I want for my patients to know a little bit more about their eye health and wellness after they come see me in clinic and in the office. If you'd like, you can follow me on Instagram at Dr. DMD, or you can also subscribe to me on YouTube at Dr. Dotson. Thank you so much for listening. Have a wonderful day. And yeah, Dr. D signing out.